So you've been diagnosed with a possible ectopic pregnancy or abdominal pain in early pregnancy. Here's what you need to know and a bit of what you might like to know. So abdominal pain is distressing at any time, but everything is far more distressing in early pregnancy. Many women who have abdominal pain or vaginal bleeding go on to have a normal pregnancy. What we're worried about in particular is an ectopic pregnancy or a tubal pregnancy. That's a pregnancy inside your tubes. Now the uterus, when there's a pregnancy there, a fetus there, it can expand to many times its size just fine, but the tube cannot continue to expand as the embryo grows. If you don't treat it, the tube will rupture, and that can be life-threatening for a young woman who's pregnant. So we treat it very seriously, and you need to treat it seriously too. Now, we monitor the pregnancy with several tests, blood tests and an ultrasound. Likely you got an ultrasound today or have one booked, and we couldn't see the pregnancy yet, so we need to repeat that ultrasound. Once you get home, I want you to call your obstetrician or your family doctor, whoever is following your pregnancy, as soon as the office is open, and try again and again until you get through to the administrative assistant. Once you do, you need to tell them that you are seen in the emergency department with a possible ectopic pregnancy. They will book you in for an early visit where they can do more blood tests, repeat those pregnancy hormone blood tests, and another ultrasound. And that will tell us whether or not you do indeed have an ectopic pregnancy. But it's very important to get those tests booked, so do call right away and let the administrative assistant know what you have. In the meantime, just take it easy. Don't do any strenuous exercise. Avoid sexual intercourse for a little while you're having vaginal bleeding or pain. We don't know that these things actually work. There's no scientific evidence behind them, but we recommend them because there's no harm in recommending them. Reasons to come back to the emergency department. There's 5 of them. Number 1, if you have a fever, you need to come back. That's 38 degrees Celsius or 100.4 if you're using Fahrenheit. Do take your temperature, use a thermometer. Number 2 is if you're feeling lightheaded. So when you stand up, you feel like you're going to faint, everything's going a bit black. That's another reason to come back to the emergency department, as well as severe abdominal pain. Now, you may have come in with a bit of abdominal pain, but if it suddenly gets a lot worse, you have to come back right away. Another reason to come back would be severe nausea and vomiting, or to have heavy vaginal bleeding. That would be soaking through more than 1 pad an hour. That's another reason to come back to the emergency department. Otherwise, do follow up right away with your family doctor or obstetrician, whoever is following your pregnancy. I'm Dr. Atzema, and those are my discharge instructions for possible ectopic pregnancy.